Welcome to the Physicians of Frisco. I'm Wendy McGowan Ellis, and today our guest is Dr. Bradley Barth. He is a pediatric gastroenterologist at the brand new UT Southwestern facility here in Frisco. Dr. Barth, thank you so much for being with us today.
Thank you.
We're so glad to have you. So tell us all about the UT Southwestern practice up here and the gastroenterology and how you came to be a part of the brand new hospital that's here in Frisco.
All right. So University of Texas Southwestern is a medical school in Dallas and the primary teaching institution in the Dallas-Fort Worth area. So I have been faculty there since 2004. Came here from Boston. I grew up in Houston, college in Austin, med school in San Antonio, and then I went into my training in Boston and moved back in 2004. So I've been faculty in pediatric GI since then. And I spent a ton of time building an endoscopy practice and kind of laying the groundwork and the infrastructure to build a program in Dallas at the main Children's Hospital, Children's Medical Center. And then subsequently, we decided that we finally had the manpower and the infrastructure to expand. So now we are offering pediatric specialty services up here in Frisco at the new UT Southwestern building.
What do you think sets the practices up here apart from others?
The primary difference, there's tons of great doctors up here.
Right.
Primary difference between us and them, I would say, is that we're med school faculty, which means that while we're first and foremost clinicians, we also spend a lot of time teaching. So that's a huge part of what we do professionally. And when it comes to patient care, I think that we are more inclined to spend a lot of time explaining our thought process, talking to kids, talking to families, and making sure everyone understands exactly what we're thinking.
Now, Dr. Barth, I imagine with children, it's hard to get them to describe accurately what they think their challenge is. They just know their stomach hurts. So what is it like for you in helping to diagnose children and then solve those problems?
That's actually the really fun part of my job.
Oh, good.
So it is a little more challenging, but over time and with experience, you kind of get the hang of it. And there's certain things that kids respond to. You know, does it hurt more here or here? Does it ever hurt over here? What does it feel like? When is it worse? And yeah, there's times when you can't get an answer. When that happens, you just rely on physical exam, kind of old school medicine.
So how do you personally connect with the kids, and then how do you put their parents at ease also?
Yeah, that usually goes together. So it depends on the age of the kid. I talk to the family and talk to the parents, and once the child sees that the family's comfortable with us, then they fall in line.
Really? Okay, that's really interesting.
Yeah.
What are some of the tools and technologies and tests that we have here at the facility in Frisco that you're using to help diagnose the kids?
So for GI, we have abdominal x-rays, we have endoscopy if needed, we have breath testing, and for other specialties, we have EEG, and we have a microscope for blood tests. And we also have something called the pill cam, which is a small camera that is housed inside of what's shaped like a pill, and kids can swallow it or we can place it endoscopically. And that takes really high resolution images of the esophagus, stomach, and small intestine all the way through to the colon. So with normal endoscopy, we can reach maybe 15 to 20 centimeters into the small intestine, and with colonoscopy, we can make it to the other end of the small intestine. But it's really difficult to see the middle, and that test allows us to do that.
That's wonderful. That's really interesting. Now, switching gears just a bit, let's get on the proactive side. You also have advanced training in nutrition. So tell us what your tips and tricks are that parents can use on how to get your children to eat better.
Yeah, that's really hard. So as a dad, I think it's more relevant, and I struggle with that. You know, the kids love chicken nuggets and they love burgers,
and it's convenient.
Yeah, and I love them too. But it's really important to have a balanced diet.
Right.
So what I tell families is try to get in fruits and vegetables as much as you can. And if you can do that, you're taking the first step. Lots of water is really important these days, especially in Texas in the summertime when it's hot. So a balanced diet with as much fruit and vegetables as possible is always a good way to start.
And another aspect of food and eating is allergies. There seems to be so many food allergies on the rise, everything from gluten to peanut to I don't even know what all you deal with. How is the practice here in Frisco helping parents to solve for those problems in their children also?
Yeah, food allergies are really common now.
Yes.
And we're not sure why this is happening. People have different theories. A lot of people think that society is becoming too clean, so our bodies are seeing these antigens that are in food as foreign and starting to attack them. Babies and younger children will show up with vomiting or difficulty swallowing. That's a problem that we deal with a lot. So we have a food allergy specialist in pediatric GI in Frisco who works with me named Dr. Akash Goyal. He's a great guy. And all of us are happy to take care of patients with that kind of problem.
Okay. Are there any other pediatric specialties besides what we've talked about here today that are here in Frisco that our audience should know about?
Yeah. So we have UT Southwestern Pediatric Specialists from ear, nose, and throat, pediatric urology, neurology and epilepsy, pediatric ophthalmology, pediatric gastroenterology, hematology, pulmonary and respiratory medicine, and also adolescent medicine.
Wow. So I think the message is that if you are a parent here in Frisco, you can have anything that is going on with your child seen to at UT Southwestern here. And we are so excited about that. That's so wonderful that you and your other fellow doctors are bringing the kinds of expertise that you're bringing up here right in our own backyard.
Thank you.
Keeping our kids healthy here in Frisco, Dr. Bradley Barth, thank you so much for being with us here today.
Thank you.